I'm here with Ken, who has just presented the quality of life part of the vision trial. What was the most important message?
The most important message is that lutetium-PSMA-617 is not only a very efficacious treatment, but also significantly improves the quality of life of patients. And the big thing why this really kind of changed the way I look at it was a recent analysis done by Josh Mailman, who's a patient representative. Most of you know him for neuroendocrine tumors. And he asked patients to rank different combinations like longer life, but and high quality of life, longer life, medium quality of life, longer life, low quality of life compared to medium prolonged life, but high quality of life, and so on. And you will be very surprised, but the most dominant part, or at least I was surprised, the most dominant part was really the quality of life.
When we talk about nuclear medicine therapies, who do you think should be in the lead? Obviously, the urologists, as we have seen, and the oncologists and the radiotherapy oncologists are all waiting for using our therapy. Who should be in the lead?
So first of all these advanced therapies belong to the MDT, right? The multidisciplinary approach. I think this is key, and everyone needs to know that we have to be a whole team, almost like in football. You need almost 11 players to really take care of it. However, if you ask me who is supposed to then finally apply the radioactivity, I'm very biased, right? I'm a nuclear medicine physician. This is our job. We need to be there. We need to make sure that's us.
So for those who just start to set up a therapy unit, what is the most crucial part of being successful in nuclear medicine treatment?
But I think the most important thing is the same as a full marathon. If you want to make it to the goal line, you have to start it.
So when I looked at the abstract book, your name appears approximately 30 times, so that's a big achievement. How do you manage work-life balance?
Very difficult question. So because it's not easy. I'm very honest. So this is one of the tasks I have for next year to get better on that. But this being said, we are expecting a certain change in our personal life that this hopefully will put everything in perspective. But yeah, I mean, this obviously work-life balance is a challenge for many of us, probably including yourself.
2 small children. So you're obviously very successful. What is your advice for our young colleagues or young people who just start the first attendance? What is it that they should always keep in mind?
The most important thing, I think, not to worry and not to be afraid. And if you ask me which trait is the most important trait, I want to cite one of my mentors who said, you need to have the love of the game. And it's true. You really need to love what you're doing. And if you do this, then you will get far. And you will like what you do. And you will actually cope better with disappointments. Because, and again, you know very well as well, life is full of disappointments. And if you love what you're doing, it's much easier to cope with it.
So just love what you're doing. Keep on doing it. Keep on arranging your life around it. And then you will be successful. This was Inside EANM 22. Stay tuned.